All right, thanks, Glenn. Time now to answer some of your common health questions. Joining me, News Channel 5's medical expert, Dr. David Soria, the Chief of Emergency Medicine at Wellington Regional Medical Center. First of all, thank you so much, as always,
welcome.
for coming in.
Good to see you, Mike.
First question here is, can swimmer's ear be harmful? So much water around Florida.
Yeah, we're kind of ending the season, but it still impacts us because we swim around here year long.
Sure.
Swimmer's ear is the same as external otitis or otitis externa. Basically, that's an infection of the outer canal that leads to the eardrum. A little different than the middle ear infection, which is the eardrum itself. Now, swimmer's ear can cause a lot of pain, cause swelling, drainage from the ear itself, but it actually uncommonly causes complications, but it still can. What it can do is it can rupture an eardrum. It can cause an infection systemically that can travel to the bone underneath the ear, and then rare occasions it can actually cause meningitis. So the times that I would want you to see your doctor is obviously if there's a lot of pain, but also if you develop a fever, if there's a significant amount of pain in the bone here beneath the ear, and if you develop a stiff neck or a headache, absolutely come see us. We need to make sure it's nothing more serious than that.
Okay, take care of it right away, right there.
Yes.
All right, second question. Seeing spots in your eyes, is that a dangerous situation?
Yeah, typically it is not. What those are called is floaters, and those are small little specks that can kind of float around your visual field. Typically those are from small pieces of collagen that can break off over time. Rarely is that indicative of anything serious, and typically over time they actually resolve. But that can be a sign of something more significant that's going on with the eye. So for example, it could be a retinal tear, retinal detachment, diabetic neuropathy can do it, and then rare cases, eye tumors. So when do I want you to go see your doctor when you see floaters? Well, it's always a good idea to get it checked out, but certainly it's more significant if you see an increase in the number of floaters acutely, if you see flashes of light, if it's associated with pain, if you have any sort of visual loss, or if you start to see floaters after eye or head trauma. Absolutely come see us. We need to check you out.
Is there any certain time when people are seeing the most spots in their eyes, maybe getting up too fast, or is there any...
Typically not. You see them the most when you're looking at something bright. So if you're looking at the sun outside or at a white sheet of paper, that's when you'll see those floaters most prominently.
Always here to have your back is Dr. David Soria. If you have a question for him, just simply go to our website, WPTV.com, and click on the health link, scroll down, and then on the right hand of the side, that's where you'll find that form to write your question. Again, thanks for coming in, Doctor, and we'll be right back after